So in general, the cystic lesion of the jaws is painless swelling. But once it is infected, so it will give what we call the painful swelling. The cystic lesion actually it gives swelling. So there is facial asymmetry. There is asymmetry because there is swelling in one side. So this causes also facial asymmetry. Sometimes it may disturb occlusion. The occlusion may be disturbed due to this swelling. Or sometimes it may cause loosening of the teeth, or sometimes drifting of the teeth. This is here drifting, the cystic lesion cause drifting of the teeth or loosening of the teeth because bone resorption. Sometimes the cystic lesion might press on the blood vessel and nerves, and this will lead to devitalization and discoloration of the teeth. So drifting, loosening, discoloration, devitalization. Sometimes the cystic lesion might press on or cause pressure on the nerve, and this will lead to anesthesia or paresthesia. For example, cause pressure on the mental nerve or inferior alveolar, so cause anesthesia or paresthesia. Sometimes the cystic lesion may cause resorption on the cortical plate, superior or inferior, and this cause actually bone resorption in the cortical plate, and due to occlusal trauma, this may lead to pathological fracture of the jaws. So actually, this is the most sign and symptom of the cystic lesion of the jaw. So it is painless swelling, and usually there is facial asymmetry. Sometimes actually, and because of small size cystic lesion of the jaw, the cystic lesion could be discovered by routine radiographical examination. For example, if the patient needs to for extraction of certain tooth, and we take X-ray for this X-ray for this tooth. In this case, we may discover there is cystic lesion and it is small. So it can be discovered by routine radiological examination. So there is facial asymmetry, there is drifting or loosening of the teeth, devitalization, discoloration of the teeth, anesthesia or paresthesia. Sometimes it might give also salty taste because of the content of the cystic lesion. The diagnosis of the cystic lesion could be through clinical examination. Usually there is swelling, but if it is small, it cannot be discovered by clinical examination unless there is radiological examination. So through clinical examination, for example, if there is swelling, for example, history of tooth extraction may indicate residual cyst, or history or what we absence of one of the teeth in the series or one of the tooth in the series. In this case, it might indicate primordial cyst. Also effects on the jaws, whether there is loosening of the teeth, drifting of the teeth, devitalization, discoloration, anesthesia or paresthesia. All of these may give also one of the indication there is cystic lesion of the jaw. Radiographical view. Actually, there are many types of radiographical view. Could be peripheral view, or could be OPG, orthopantographic view, could be occlusal view. These can be used for small cystic lesion. For small cystic lesion, we can use peripheral, we can use orthopantographic, we can use also occlusal view. But in case of large cystic lesion, usually people for accurate diagnosis, because usually the large cystic lesion it becomes very close to the vital structure, inferior alveolar or maxillary sinus, or even any structure. In this case, it may lead to CT scan or CBCT, computed cone beam computed tomography, or we might need also magnetic resonance imaging, MRI. Actually, this is very important for accurate diagnosis. Here I have to mention that the radiographical feature of the cystic lesion of the jaw, usually the cystic lesion appears as unilocular or multilocular radiolucency, and this radiolucency is surrounded by radiopaque line. Actually, the radiopaque line will be discussed later on. This is due to bone formation, so it appears as a layer, radiopaque layer surrounding the radiolucency of the cystic lesion. So this is the radiographs used for diagnosis of the cystic lesion. Aspiration, fine needle aspiration to aspirate the contents of the cystic lesion, usually whether it's straw or even yellow color. So this could be used for the diagnosis of the cystic lesion. Contrast for maxillary sinus. Actually, since maxillary sinus it is ear-filled space, so usually appears as radiolucence, and it's difficult to differentiate between maxillary sinus, the radiolucency of the maxillary sinus, and the radiolucency of the cystic lesion. So, by injection of contrast material within the maxillary sinus, such as barium, for example, barium sulfate, in this case we can differentiate between the radiolucency of maxillary sinus and the radiolucency of the cystic lesion of the jaw. Ultrasonic could be used, actually this is for soft tissue cystic lesion. Actually also there is what we call biopsy, which is biopsy that means it helps in the diagnosis of the types of the cystic lesion. So if we need to diagnose whether this is cystic, in general cystic lesion or tumor, in this case we can use radiographical or clinical examination. By the way, through clinical examination, by tapping on the swelling, we can hear the eggshell cracking. Eggshell cracking indicates this is cystic lesion. So also this feature might be held during clinical examination. So ultrasonic actually, in the last point, ultrasonic could be used for the soft tissue cystic lesion. For example, in case of ranula, in case of mucocele, whether if it needs the ultrasonic. But in general, the diagnosis of the cystic lesion could be clinical examination. As I mentioned before, the clinical examination, the history of the cystic lesion. Effects on the jaws, actually also. Radiographs, we said, for small and for large cystic lesion. Aspiration, sometimes biopsy, by taking a piece of soft tissue and sent for histopathological or histological examination. It can be helped in the diagnosis of the type of the cystic lesion, not whether the cystic lesion or not, but type of cystic lesion, whether keratocyst, radicular cyst, dentigerous cyst, and so on. Contrast to differentiate between the radiolucency of the maxillary sinus or the radiolucency of the cystic lesion, and ultrasonic mostly used for the soft tissue cystic lesions such as ranula and so on. So this is the end of the lecture, and thank you for your attention.